and welcome into Getting Help from Uncle Sam. And we really are getting help from Uncle Sam. We finally are getting some additional help from Uncle Sam. And Kent Davis, the Commissioner of Alabama Veterans Affairs, you have some news that I think is so good, and we wanted to share that with our audience. There's been such a focus on suicide, opioid addiction, very, very prevalent in the veterans community, and these are our best folks. So we finally have help coming, and what is that?
We do, Virginia, thank goodness. So a lot of talk about mental health in the state of Alabama. Thank goodness, there needs to be a focus on that. But mental health issues tend to have a disproportionate effect on the veteran community, and we're seeing very high rates in Alabama of opioid addictions and unfortunately veteran suicides. And sometimes they're linked, those issues, all of these mental health issues. Help is on the way. Alabama has joined with other states to enter into a settlement, an opioid settlement, and Alabama is scheduled to get over $270 million in that settlement to help abate, is the word, the opioid crisis in this state. I'm on that commission that's making recommendations about how to distribute those opioid settlement funds. Great group of people that are on that commission. They're going to spend a little more time making recommendations on how to distribute those funds. We have asked through the State Board of Veterans Affairs, and I did a presentation last week asking respectfully that there be an earmark of those funds, a substantial set aside to specifically help the veteran population in Alabama.
Amen.
And hopefully that'll come to fruition in the next few weeks.
So with the distribution of these funds, what are the, if you just had your way and you could put those where you wanted to see them go, where would you want them to be used?
We have great partnerships already with the federal government, with other state agencies, including the Alabama Department of Mental Health and Public Health. But some of our most valuable partnerships are with private sector organizations, including nonprofit organizations that provide tailored services to veterans, including things like peer-to-peer counseling services, because oftentimes a veteran will talk to another veteran when they won't talk to anyone else.
I agree.
And those are the most effective programs that we can see. Those community-based programs, if we can get those funds in the hands of those proven effective programs, that's what we hope for, along with our other partners that we already work with.
We wanted to touch on too while we're talking. What do you attribute such a prevalence among the veterans?
Yeah, it's a great question. There are a lot of studies, and we know some of the reasons why it disproportionately affects the veteran community. First of all, veterans are much more prevalent when it comes to chronic pain because of wounds and injuries that occurred during their service, especially combat service. We also talk about those invisible wounds of war, the mental health issues. Most people are familiar with post-traumatic stress, but there's simple things like the stigma of even seeking help, because in the military and amongst veterans, you know, you're taught you're supposed to be tough and handle your own problems, and just getting veterans to come forward and admit that they need help is tough sometimes, and it builds up inside them. You have other issues as well, social isolation that comes during the transition from military to civilian status. All of those factors tend to combine to just have an over effect on the veteran population.
I think one of the things that I have seen is, you know, in the military, you're in a squadron, it's a team, and you all, even I remember from our Vietnam vets and having been married to one, they saw all the same thing. They had all that common where they understood each other, like mothers understand mothers. I mean, I'm serious. And then when they got out of the service, they no longer had that squadron around them, that team around them, where they had already together gone through and seen so many things that so many of them should never have seen.
Yeah, I can tell you personally, we talk about in the military camaraderie and esprit de corps and the team unity. It is a tough transition. I mean, my most recent deployment was 11 years ago, but you come out of an environment like Afghanistan where I served, where you're surrounded by that team and you feel like everybody's got your back, and then all of a sudden you come back and you're told, go back to your normal civilian life. Oftentimes, that's not easy.
No.
And it can cause some of the mental health issues that we see.
Well, I think that we also talked about mental health has a lot. Sheriff Cunningham has said a lot of
Good
the
man.
crime. Oh,
Yeah.
I love him. A lot of the crime, it's partly mental health.
It is.
But the problem is, I think that I hope that some of this funding will go to training more psychiatrists, to
Yeah.
training more competent staff, because when they come into our emergency rooms, you know, you can take somebody with a bad cold or the flu, they sit in that little room and wait. If that is a mental health problem, Kent, they can't do that. You're going to have somebody with them. You cannot leave them alone. So you're already understaffed. It's a very domino effect. We really need help. And our veterans deserve that. They have worked for that. They have put their lives on the line for this country. And it's inexcusable for us not to do that.
Well, thank you for saying that. I think everybody in the state acknowledges now that we need more mental health services across the board. But again, these issues disproportionately affect the veteran community. And I'm a little biased, obviously, but
So am I.
I think we owe it to them, having served their country.
We're blessed to have you, and you are a veteran, so you understand.
Absolutely.
And thank you for all you've done for our country. You and your wife, Lisa, wonderful woman. Thank you. And we will get behind you every way we can.
Thanks, Virginia.
Thanks for being with us, and we'll have Commissioner Davis back.